So what is the purpose of the NCLEX? The purpose is to determine that you are a safe and effective nurse. You do not need to prove the NCLEX that you are an expert in content. However, you need to be able to apply nursing knowledge and help with the patient's problem. You will face a test that will measure your competency and cognitive development levels. The NCLEX will measure your ability as a nurse with a computer adaptive test. If you answer the question correctly, as a gift, you will get a higher difficulty question. If you answer a question incorrectly, you will get an easier question. And by doing so, the NCLEX will determine if you are a safe nurse. Your sole purpose is to stay above the passing line at all times to show the NCLEX that you are a safe nurse. There are different style questions. Some questions are below the passing standard and some questions are above the passing standard. Now, what is the key? What is your purpose? What are you trying to achieve? You are trying to stay above the passing level at all times. But how do you get there? You have to show the ability to think critically. Questions that are below the passing standards are recall and recognition questions. In other words, they are type of questions that you have to use memorization to answer them. But the questions that are above the passing level, you have to prove that you have an ability to think critically. I will give you some examples. Let's practice some questions together. And I want you to identify which questions are below the passing standard and which questions are above the passing standard. All right, let's practice.